Obs and Gynae paper and 2 hours. So you will have 120 minutes. 120 minutes to answer these 5 questions. So in general, so when you are answering the question paper, you have to scan through the questions, and so people do different way. Some start writing the answer to the easiest question out of 5. So others will start with the first question, and in the sequential way they answer the paper. That is up to you to decide. But sometimes there are advantages and disadvantages of answering the easiest question for you. So then you spend much more time. But my advice, you to spend the particular time allocated for the question, not to take even single minute more than that, because each question carries same marks. Okay, right. So then first question, so you know that first question we ask is a kind of essay type question. So here, so we ask about discuss the possible strategies which could be adopted to optimize the perinatal and maternal outcome of elective induction of labor. So here what you have to first do is, so you have to identify the key words you have to discuss, and then strategies, and then optimize the perinatal and maternal outcomes of induction of labor. So these words are very important. Discuss strategies to optimize outcomes of mother and baby with the elective induction of labor. So unfortunately, so what happened is, some student doesn't know some words here. So they are asking what are the meaning of different words. For example, optimize. What is the meaning of optimize? Those are technical words. We are not supposed to tell the explain. When you come to the exam, so we use some wording. You have to have some understanding of what are those words, particularly in the EMQs, SCQs. So these are the things that when you go to previous question paper, you will understand. Then anytime, so you can ask from us, what are the meaning of these words? Otherwise, if you don't get the full understanding of these words, it is very difficult to answer the question. You will go in wrong track. Discuss means, so you have to talk about pros and cons, what is the ultimate conclusion, and these things. Strategies, so what are the activities, what are the things that you have to do. Optimize means improve or prevent complications. Perinatal means around the baby, that means before delivery, intrauterine life, and then up to 7 days. Perinatal mortality. You know perinatal mortality. So when the baby is viable means viable after 28 weeks, up to 7 days is a perinatal period. So then outcomes. Outcome means what are the things that you are expect, the things that can complicate or badly affect the baby and mother. So those are the words that you have to have a clear understanding. So then only you can answer the question. So basically we are asking to discuss what are the activities or what are the things that you have to do to improve the babies and mothers' complications with related to induction of labor. So that is the simple meaning of this question. So keeping it in your mind, then you have to start answering the question. So in this kind of essay question, you know that you have to follow basic flow. So first of all, you have to write some introduction. Each part will carry marks. So I will show you the how we are going to give the marks. And then you have to have a body, introduction, body, that main part. So particularly about the measures, so you have to explain. Then at the end, so you have to give a conclusion. When you adopt to these things, so what will happen? Okay, we'll go to the answer. So you will see here. So you will see here the introduction. So there should not be a particularly ready-made introduction, but usually when you give the introduction, so you have to give the gravity of the problem. Not so. For example, this is the induction of labor. For example, if you ask about the cesarean section, so you have to give the gravity, what kind of problem it is, what kind of the procedure it is. So what is its importance to the obstetric practice, something like that. So for that, so we allocate 15 marks. It is significant number of marks for the introduction. So you have to say that, so general thing about the induction. So you know that induction of labor is happening in everywhere in obstetric setting. It is an important procedure, whatever that thing. So essential component in the obstetric practice. But we know that even though it is important, but it is in increasing trend due to some reasons. So if you do unnecessary or whatever, if it is not up to standard, so you are asking for trouble. That's why, so we are concerned about the induction of labor. So we are doing induction of labor to improve maternal outcomes. But on the other hand, if you are doing unnecessary things, unnecessary inductions, so you are asking for trouble, not the hello, can you hear me?
Yes, sir.
Hello.
Yes, sir.
So you can hear me?
Yes, sir, we can hear.
Yeah. So then, so you have to give the kind of initial information. So then you have to. So here we mention, so induction of labor is increasing trend worldwide. So but particularly in Sri Lanka, you know that WHO is mentioned the highest induction rate in the world is Sri Lankan figure. So because of that, it is very important to Sri Lankan setting. It is not the optimal rate we are having.
So can't see the answer.
Hello?
Hello, sir. Can't
Sir,
see
we
the
can't
answer.
see the model answers, only question paper is.
Can't you see the answer?
Yes, sir.
Yes, sir.
Can you see the answer?
We
Not, sir.
can't see the answer, sir. We
On
can
the question paper.
Why is that? So because I shared the screen.
we can see the question paper, sir, not the answer.
All right. Okay. Sorry. Wait. Can you see now?
Yes, sir, we can see.
Can you see the screen now? The answer.
Yes, sir, we can see.
Okay. Right. Okay. Right. Let me know. Right. If there's any trouble. So so here introduction, then body. What are the measures? Then at the end the conclusion. So here what we have to mention is the introduction. What kind of the problem it is, what is the gravity, what are the issues at the moment with the induction of labor. But we are expecting a good outcome, but despite of that, unnecessary induction can lead to bad outcomes. So that is why we want to address this issue, because Sri Lanka is known to have a highest number of induction in the world. So WHO particularly mentioned in the annual reports about this thing that is not good for to Sri Lankan setting. So because of that, everybody who are engaged in an obstetric practice should know about this thing, because it is a world concern. Okay, so we have allocated the 15 marks if you give good introduction. Right, so now we are going to discuss the measures. So for inform, so you have to explain in your answer, you have to explain. So here, so in point form, we mention, so what are the things that, so you have to concern about when you are doing induction. First of all, when you decide induction of labor, you have to confirm the dating, because so you do induction early. So if there is a wrong dates, you don't confirm the date. A lady's date is wrong. So you may deliver the baby early or either early or late. So that is not good. If you deliver the baby prematurely, so that is not good for the baby. So first thing is that you have to confirm the dates. You go through her history, see her clinic notes, and see whether she has had dating scan. That's why dating scan is compulsory in the current obstetric practice. So if the dating is, that is the first thing that you have to look into. So it will carry, when you explain that, it will carry 5 marks. See whether you can think of these things when you are giving answer. Then second one is maternal education and counseling. So this is the informed choice. You have to tell why you are doing induction, what is the benefit to the mother and baby, what are the complications can happen. So then you have to educate the mother and couple about this thing, and then after that, so you have to get their willingness for the induction of labor. So they are aware about that, what is happening now. So that will carry 10 marks with the maternal education and counseling about what is the reason, what are the benefit, what are the associated complications of induction of labor. So then you have to explain that these are the in point form, but in your answer you have to explain. Then if you explain that, you will get 10 marks. So when you are answering the question, so the definitive things should be there, but just touching things are not carrying full marks. Then third one, the candidate selection. That's mean the selection of the patient indication is very important. So there should be a clear indication for the induction of labor, not just simple the indications for because this is a big decision. So you know that there are so many indications for the induction of labor. Most common reason for induction of labor is a past date. In addition to that, medical conditions, fetal condition warrants induction. So then it has to be a consultant decision, or one of the most senior experienced obstetrician should decide induction of labor, not the middle grade doctor. Then you have to clearly document in her notes. So induction of labor done, decided by whom, done due to this reason. So if you mention these things in your answer, so you will get 10 marks. So get the clear understanding how we are marking your question paper, depending on the very clear marking scheme. Then fourth one, so pre-induction, so you know that you can't induce the labor all of a sudden. So you have to ripen the cervix, that is called pre-induction cervical ripening. So then the success of the induction, the achieved vaginal delivery rate is increased. So then So you have to do the pre-induction cervical ripening before induction proper. So then you have to use, so you have to acknowledge there are effective methods, pharmacological and mechanical methods. So pharmacological methods, so you can mention some method like prostaglandin, mechanical method, not in details. We don't expect any details of these procedures because we never ask the question. So what are the method of cervical ripening and explain. So that is not the question we ask, but you just show that you know about this thing, you just mention examples. But when we go to your seniors question papers, the most of the situation they explain what are the methods, how they are doing, so how they are inserting Foley catheter. So those are, you can see whether these explanation will carry marks or not. It doesn't carry marks, only few marks, 2-3 marks you to mention these pharmacological mechanical methods. But when you go into your seniors, this thing wholesale, they mention about the different method of induction of labor, A to Z, not the expected answer. So you have to understand that. So you are waiting for the forthcoming exam. So you have to understand clearly the question. So what are the points that you have to write? Then you know that. So with the pre-cervical ripening, so patient can go to have complications, hyperstimulation, infection, bleeding, uterine rupture, whatever, pre-induction. So then you have to monitor clearly. Very well, you have to monitor CTG, fetal monitoring, and then you have to auscultate fetal heart history. So you see in the wards after prostaglandin induction, prostaglandin insertion, how we monitor the labor, the mothers. That you have to mention, that will reduce the maternal and fetal problems. But again here, so what you are going to write here, your seniors, in details, what is the uterine hyperstimulation? How we are going to manage the uterine hyperstimulation? You go to the question and see whether we ask about the how we are going to manage the uterine hyperstimulation. No, we never ask that in your question. So if we ask how we are going to monitor and how we are going to manage the uterine hyperstimulation or complication related to pre-induction of labor, then of course that is the answer. You don't get marks for explaining the management of uterine hyperstimulation, but you have to acknowledge there are conditions that you can get hyperstimulation, infection, uterine rupture, fetal distress with this thing. So we have to monitor with different measures, CTG, monitoring, history taken, and these things. That's all we need. And you have to acknowledge other thing is ASM, artificial separation of membrane, is safe and recommended for all post-dated pregnancies, because so it may more ripen the cervix, so itself going to the labor, woman going to the labor with the ASM. So that is recommended for all post-dated pregnancies, the current practice. So you can see that you can get 20 marks for these details. Right. So other facts. So when you induce the labor, so she's going to the labor room, then you have to manage her labor. So how you are going to manage her labor? So that is the place that you can get a lot of complications. Labor management. So there are labor management. So you have to consider this patient is high risk category. So these are the solid words that you need to know. High risk patient. Labor management has to go in high risk category. So then what is the high risk management? Then you know what is the high risk management. Continuous fetal monitoring and maternal monitoring is very important in the labor management. Then senior level management is important when the middle grade doctor or registrar has to assess the labor, not the house officer. This is a high risk. House officer can assess the labor in a low risk category. But when the mother is in a high risk category, it has to be a senior level assessment, either middle grade doctor or consultant. consultant doesn't come every time, but so if there's any issues, then you have to inform. Then senior level assessment is compulsory in this kind of high risk category. So you will carry 10 marks if you mention high risk category, continuous monitoring, and the senior level involvement. So this is a model answer. This is the model answer, but so you can apply for each and every question how we are going to give a perfect, concise and solid answer for the question. Then induction of labor should carry out where the emergency obstetric care available. So emergency obstetric care, this word. So what is emergency obstetric care? Emergency obstetric care is where the blood bank facilities available, theater facilities available, and anytime if a woman need to have cesarean section or forceps delivery, there should be a facilities available with a neonatal resuscitation. So that is an emergency obstetric care. Can you induce a labor in a Nelu hospital? Can you induce a labor in the district hospital Akurasa? No. So that is the idea you should get with. You should not induce a labor in a place where there is no emergency obstetric care. Because in any case, if woman or baby have problems, so there should be facilities to tackle with that. So that will save mother and baby and reduce the perinatal morbidity and mortality. So if you mention that, you will carry 10 marks about the emergency obstetric care. Then we will come to oxytocin. So induction of labor, how you are going to do the induction of labor? You do the cervical ripening. So then when the cervix is favorable, that's mean more than 7 Bishop score, you send to the labor room and do ARM and start oxytocin. That is the induction of labor. The oxytocin that you have to acknowledge, the oxytocin is there are so many drugs in the world, more than 5,000 drugs in the world. So there are 10 drugs which considered dangerous. There are 10 drugs out of all drugs. There are 10 drugs considered dangerous drugs. So oxytocin is the one of the dangerous drug in that category. So when you do, give a woman with one of the dangerous drug, but is beneficial hugely, but there are some other problems can happen. For example, uterine rupture, hyperstimulation, fetal distress, fluid retention, electrolyte, so many problems can happen with oxytocin. Even maternal death, embolization, or the amniotic fluid embolization. But if you use oxytocin with the good hands, with the good the care and follow protocols, you can see that there are protocols. So government guideline recommend you to use the oxytocin regimen, adhere to the protocols. So everywhere, every hospital where the obstetric facilities are there, the Family Health Bureau is distributed infusion pump. Nowadays, you don't send the oxytocin with the gravity dependent drip set. So that is dangerous because you can't control the drug doses because it is a dangerous drug. Per se can kill the baby and mother. Excuse me. Hello. Hello. With care, adhere to the protocols and use with the infusion pump with the controlled manner. So these things you have to tell in your answer. You will get the 5 marks if you tell that. Right. So that is the other one also is strictly comply with the guideline. So you see that induction of labor guidelines available in our unit. Every unit should have their adopted guidelines and protocols. So then everybody should follow that guidelines and protocols, not according to your weave, right? So following guidelines and protocols, and with you and updated your this thing and recommendations with the use of oxytocin and induction of labor is essential to reduce the fetal and maternal problems. So it will carry another 5 marks. So you know that the induction of labor known to cause increase in pain. The pain per se can cause dehydration, maternal distress, fetal distress, and bad experience in the index labor. And then next time she will ask for cesarean section purely due to pain. So that is maternal outcome. So pain relief is a main component in the labor. So because you start oxytocin, you do ARM. So you are creating artificial contractions. So she will get a lot of pain. Not like a spontaneous onset of labor. So then you have to explain. So what are the ways that you are doing to the woman to relieve pain? There are different ways. So at best is epidural. So other measures you can take to relieve her pain. So then you have to give a small explanation for that. So if you mention that, you will carry another 5 marks. So that is main body. So you see that in the main body, particular things that we are mentioning here. So labor management, use of protocols, adherence to the guidelines, labor pain management, pre-induction cervical ripening, what are the methods, how you are going to monitor the babies, and induction, the documentation, the education, counseling, proper case selection, senior level enrollment. So those are the things that you have to follow to reduce the fetal and maternal complications. So there are other minor things you can mention, but those are the crush of the matter. So then conclusion, you have to say that if you manage the induction of labor with the proper way, so you have to tell the induction of labor, there is no doubt it is a compulsory component in the modern obstetric practice. But if you go beyond the optimal, beyond the limit, so you are asking for trouble. So you have to acknowledge in the conclusion, induction of labor is an essential component of modern obstetric care, but it can badly affect the fetal and maternal well-being. But if you apply these measures, so you can bring down the complications and you can have improved the outcomes in the mother and baby. So that kind of conclusion you have to give at the end. So that will carry another 10 marks. So this is the kind of model answer for this question. You to obtain the maximum number of marks, but it has to not. There should not there. Sometimes you can do the right haphazardly then and there, but if the meaning is obvious, so you can get the marks. But there are, then you can see that there are particular words we use here: emergency obstetric care, pre-induction cervical ripening, and protocols, guidelines, senior level enrollment. So those are the words that you need to know when you are writing the answer. So do you have any questions? Is that clear to you how to write the answer for this kind of question? That clear to you?
Yes, sir.
Okay, right. So basically for you can see there are questions in the past papers also. The first question kind of essay type. When you write, so follow the same rule. Questions are different, but follow the same rule. So then only you can score maximum number of marks. Otherwise, you can score marks average. You can't go beyond that. Right. So then we'll go to the next question. So I want to show you that what you answer here. Then other questions we simply discuss what are the expected answers in these questions. So these now we are coming to the typical structured essay type questions. So there is involving questions. Basically, we ask about the starting from the small things to management level. So here the question is 28-year-old primary gravida presented at the period of gestation of 35 weeks with a history of body aches and vomiting for 3 days duration. On examination, she was icteric. So then you have to think that you have to understand what are the keywords here. So you have to see that primary gravida plus pregnancy, 35 weeks, and vomiting and body aches. She was icteric. By going to this question, you will understand there is some liver involvement. There is some liver involvement. Pregnancy, liver involvement is terrible. That is the worst combination can happen. Pregnancy, liver involvement. So you understand the keywords here. You understand the gravity of the problem. And then you have to think have you ever experienced this kind of a patient in your ward stay? So if you have done your professorial unit appointment, at least you will see at least one patient in your professional appointment or more than that. So if this is not uncommon. So we see in the clinical practice, we see in the wards, you involve in the management. So that is why we are asking this kind of question. This is not a hypothetical question. This is absolutely what you see in your clinical practice with their presentation with the liver involvement. And it is, if you miss this patient or if you badly manage this patient, so it is mother will end up with maternal death or fetus will end up with a stillbirth. As I said, the liver and pregnancy is worst combination. So first question is asked, very easy, list 5 possible causes for her presentation. When you are writing down the possible causes here, any question, if you ask, so first of all, you can have obstetric complication, you can have non-obstetric complication, but non-obstetric causes. First, try to write down the obstetric related causes and then non-obstetric. So you know that this is a liver in pregnancy. So patient can be icteric, the patient can have vomiting and body aches due to liver involvement. 3 days, that is acute cause. You can't have cirrhosis here because it is a chronic disease. Acute liver involvement in pregnancy. So what are the obstetric? But here causes mentioned different ways. But first, you have to write obstetric reasons. So obstetric reason for the liver is, HELP syndrome. Second one, you can write acute fatty liver. The third one, you can write obstetric cholestasis. Those are the 3 liver involvement in pregnancy. HELP syndrome, acute fatty liver, and severe obstetric cholestasis. They can present with this kind of symptoms. Excuse me. Sorry. So what are the other causes? The non-obstetric cause you can the frequently see is viral hepatitis. Viral hepatitis. Then in addition to that, the intrahepatic cholestasis, those are non-obstetric. Drugs toxicity can cause this kind of presentation. basically here, when we are marking the question paper, we mention a lot of causes, but so it is compulsory you to mention obstetric causes, HELP, acute fatty liver, and obstetric cholestasis, other two non-obstetric causes to get 20 marks. Then list and justify 5 relevant investigations you would request for this patient. So you can see other question papers also in previous question. So you will get this kind of question. First we ask what are the causes, then we'll ask how we are going to investigate and justify, and then we'll ask the management. Same kind of format. So here you have to write, you know that now what are the investigations you have to write, but then you have to justify to get the full marks. You will get 2 marks for each for listing out the investigation, and that's been 10 marks. 20 marks will carry for the justification. So here we wrote down here in your marking scheme. So serum bilirubin level, you have to measure direct and you have to then give the justification. You measure direct and indirect fraction to see whether it is intrahepatic or extrahepatic, whatever, to differentiate the level and the severity of the condition according to the levels. That you have to give the rationale of doing this serum bilirubin level to understand the severity of the condition and to see what is the total and indirect total, indirect and direct fraction. So then you can have some understanding about the what level involvement of the disease is. And then SGOT, PT, and these are liver function. Bilirubin, SGOT, PT. This will. Hello. Hello. Can you hear?
Yes, sir.
Yeah. So so you have to give you do liver function test, then serum bilirubin and SGOT, PT to see the severity and to understand and to subsequent to understand the subsequent progress of the disease. So those are the justification you have to give in the category of liver function test. And full blood count and blood picture. So full blood count and blood picture gives the idea. So how is she is having any hemolysis? Blood picture sometimes it will show the fragmented cells. So that is more towards the HELP syndrome. And the drop in hemoglobin and reduced platelet count, because with the liver involvement, HELP syndrome, you can have additional thrombocytopenia. So blood picture also and the full blood count shows thrombocytopenia. That is important to make idea whether it is related to which condition, whether it is obstetric related, fatty liver, or it is related to the HELP syndrome, to understand. And then hemolysis. Then blood urea, serum electrolyte, liver renal function. You know that the liver involvement, the next organ is damaged is kidney. So that is called hepatorenal shutdown. So then you have to aware about the hepatorenal shutdown, and so you need to assess the renal function. So then you do renal function with the blood urea, serum electrolyte to understand the renal involvement, because the woman can have subsequent hepatorenal shutdown with the renal involvement. That we need to see. Otherwise, she will go to acute renal failure with this condition. Then, of course, viral study is important to exclude viral hepatitis. So then you have to particularly mention acute viral hepatitis is caused by different viruses like hepatitis A mainly. So then you do viral studies to exclude. Then serum bile acid is diagnostic of obstetric cholestasis, but it is expensive. but it is a diagnostic tool for the obstetric cholestasis. Then blood sugar levels. You know that blood sugar levels is low in fatty liver. So it is, they get profound hypoglycemia in acute fatty liver. So then you can mention, so blood sugar level assessment, which is with the profound hypoglycemia is involved with acute fatty liver in pregnancy. So that explanation you have to give. So that is a rationale of doing blood sugar. CTG, of course, to assess the fetal well-being, because with this condition, baby can go into acute fetal distress. So in that case, sometime may need delivery after stabilizing the mother. So then ultrasound assessment of the fetus and liver is important, because liver, you can get diffuse fatty infiltration in the liver, in the acute fatty liver. Obstetric, in the other conditions, liver appears okay, but cholestasis, sometimes there's a little the calculi. So you can see whether there are any calculi in the common bile duct. So protein profile is very, very important with the liver involvement. You know that there are vitamin K dependent liver, the liver producing protein factors. So protein profile is important to see whether there is any tendency to bleed. So it is important for the management of the patient if she is undergoing vaginal delivery, cesarean section. So protein correction. Otherwise, she will have bleeding. So these things that you have to explain as a rationale of doing this investigation. Then only you carry full marks. So then, what are the basic principles of management of this lady? So in a categorical way, that when you are managing this lady, so first of all, so you have to see the mother, you have to see the baby. So you have to see whether there are any complications can develop related to this problem. And then you have to generally optimize the mother. And then you have to consider about the delivery. So keeping this thing in mind, so what are the principles of management? First principle, assessment of maternal well-being. So why you have to assess the maternal well-being? Because mother can have a complication, clotting problems. Then mother can have renal failure. So then mother can have if it is an infection, mother can have sepsis. So then you have to see mother's vital parameters, blood pressure, pulse, then the mother's general consciousness, because mother can develop acute encephalopathy due to liver failure. So maternal well-being assessment is paramount important in the management of this patient, despite of the cause of the disease. Then fetal well-being, you have to do CTG, you have to do ultrasound scan, fetal estimated fetal weight, Doppler studies to see whether baby is surviving or whether baby is having distress. So sometimes when you are informing the neonatology team, you have to tell the estimated fetal weight. So that will that is the most important prognostic factor for the survival of the baby. Then investigations you carry out, what as you said, to diagnose the condition and come to a particular diagnosis, whether it is acute fatty liver, whether it is HELP syndrome, or whether non-obstetric, and to understand is there any developing complication. Then resuscitation of the mother and baby, both with hydration, input-output chart, catheterization, ICU admission, invasive monitoring. So these are the method of resuscitation and giving supportive care for the mother. And at the same time, you have to think about the liver failure, because the complication, two complications can happen is going to liver failure and clotting derangement. Then you have to give a liver support, NAC, antiemetics, bowel motility drugs, and you know that antibiotics, the liver support. So then if a baby is premature, the steroids for the lung maturity, for the better survival of the baby, she needs a delivery. Then delivery. So what is the mode of delivery? If her cervix is favorable, there is no necessity to do cesarean section, but you can assess the cervix. If her cervix is favorable, she can have vaginal delivery. If you expect a delivery, vaginal delivery, the cervix is much more favorable. Otherwise, if a disease is progressive, she needs to have emergency section, but you have to mention after optimization of mother. If you jump and do the delivery cesarean section, so that will be bad for the baby and mother. So you have to optimize first and then arrange the delivery. So there you have to talk about. So there is no 100% need for cesarean section. If the cervix is favorable, she can have vaginal delivery with continuous fetal monitoring. Otherwise, if unfavorable cervix is there, so emergency section following optimization of mother. That explanation has to be there. That is the basic principle of this management of this patient. Then postpartum monitoring. Of course, you know that they can go to the complication after delivery also. So first 24 hours, better her to be in the ICU with the monitoring, urine output, other parameters, maternal well-being. Then after that, so you have to monitor her progress of the disease, whether she's improving or whether she's going to have other postpartum complications. So that is the basic principles of management of this baby, this mother when she is having liver involvement in during pregnancy. So according to the question asked, even though I have given a lot of facts, but according to the question asked, so you have to first ask about the causes. I said any question like this, first you mention the obstetric related causes, then non-obstetric related causes, then investigation, justify each and every investigation why you are doing that. Justification will carry a lot of marks. And the basic principle, most of the obstetric cases, when you have to divide into several components: fetal, maternal, fetal, delivery. Those are the main things, and the postpartum. Those are the four things that you have to tackle with. And complications. So any condition that can cause complication to baby and mother, monitoring and evaluation of complication. Fetal, maternal assessment, fetal assessment, delivery, postpartum, and look for complications. So those are the 5 things that you have to touch. If you keep these things ready, so then it's very easy to plan your answer. You won't miss. You can score a lot of marks. So even you know this subject very well, if you don't know how to answer the question, then you can't score marks. Right? Is that clear to you about this 2 different kind of questions? How we are going to answer? Is that clear?
Yes, sir.
Yeah. Okay. Good. Right. So if you have understanding of essay question, how to write, structured essay question, how to write, these are the 2 model answers what I explained. So that is more than enough you to write the good answer. My advice is so you have, so until you start your clinical works, even though after starting clinical works, so you are waiting for your final MBBS exam, forthcoming exam, but then and there, not only obstetric, but other question papers also. This way you have to formulate the answer. Then in the exam, it is not a big problem for you when you practice this beforehand. So I just avoid this question because this is a theory question. Theory means this is a question that, so if you go to guideline in the unit, in our unit guideline, so 3.2, you will get a 60 marks. So it is easy to get the 60 marks if you go through that our guideline. It is in the guideline in black and white how we are going to manage the patient with the cord prolapse. So list 4 obstetric emergencies except cord prolapse could occur in this patient. So she is coming with the spontaneous rupture of membrane. What are the emergencies? 4 emergencies you can get. Right. So can you get placental abruption with the spontaneous rupture of membrane?
Yes,
Possible, no? Because if a sudden rupture, so there is a decompression effect in within the uterus, you can get placental abruption. So can you get the sepsis, maternal sepsis? Is that obstetric emergency with a maternal compromise?
Yes, sir.
Of course, you can get, right? So what are the other 2 that I mentioned? I mentioned the placental abruption, sepsis, maternal sepsis. So what are the other 2 emergencies you can get? Can you get fetal distress? So is that obstetric emergency? Yes, you can get fetal distress due to different reasons. It may be a combination of sepsis or cord prolapse or whatever, but you can't mention cord prolapse here. Right. So then, so you can get, what is the 4th one you can think of? Pardon? Very good. Yes, amniotic fluid embolism. Right. So likewise, then you have to think of. So any other complications you can mention. Then already you mentioned 4 complications: abruption, maternal sepsis, fetal distress, and amniotic fluid embolism. What is the other obstetric emergency you can get? Can you think anything
preterm
else?
labor. Preterm labor.
Sorry.
Preterm labor.
Of course, preterm labor is not an emergency, obstetric emergency. Obstetric emergencies we asked about. So obstetric emergency which needs urgent the interventions. But here it doesn't mention about the period of gestation, anything about the previous section and these things. So then you have to think about this. Then you can say uterine rupture, of course, but it is not mentioned about the uterine scar here. But it is, we don't consider that as an answer here. So 4 things that we consider here is placental abruption, fetal distress with meconium, and maternal sepsis, and amniotic fluid embolism. Right. So then I am not going to answer the 3.2 because it is ready-made in the guideline. Right. 4th question. Now, so we are asking about the 46-year-old woman. So I'm going to rush from this thing onward. I just give you some idea about the how to give the answer here. 46-year-old woman was found to have high-grade squamous epithelial lesion CIN3 on routine cervical smear. Discuss the management of this patient. This is also towards kind of essay type, but you can divide into different categories and answer this question, right? So so every time you have to think, why did we ask this question? So you can see routinely in the clinic. So we see whether you are having a more experience in being with us in the clinic. So in the professional appointment, so you have particular time duration that you have to be in the clinic, outpatient department. So these are the patients coming with reports. You know that well-women clinic in Sri Lanka. So we have well-women clinic. So they are having routine pap smears. So even though we don't have well-established cervical screen program, but after 35, so it is recommended by the government health ministry women to have pap smear test, cervical screening, cervical smear test. So when they do that, so they are coming with the reports to the clinic, because MOH, they refer these patients to the clinic. So then, so you can see normal reports, inflammatory reports, inadequate reports, high-grade lesions, and malignant cells, different reports. So this is the kind of significant report we are getting from the gynecological patients whom referred by MOH in the field. So then when you see that report, then of course, so you have to think you are in the clinic setting. So how we are going to evaluate this patient? Of course, then you have to ask the risk factors, because you know that cervical malignancy is associated with smoking, sexual history, OCP, and human papilloma virus. So then you have to ask the history, see whether she's having risk factors. At the same time, you evaluate her. Then you have to break the news. So she is thinking about this is a malignancy. Then you have to counsel her. You have to particularly tell, so this is not a malignancy. This is pre-malignant, one step before malignant. But so we have to treat you. We have to follow up you. So give full counseling. It's very important. You will carry, you get a lot of marks mentioning counseling the patient and tell the subsequent management of this patient. Then clinical setting, what you are going to do in this patient is, next step is to arrange the colposcopy and directed biopsy to see whether this is in microscopic invasive lesion or not, because CIN3 is considered as high-grade lesions. So rarely they can have microscopic invasions. So then the colposcopy is the one that you have to arrange. Then you have to tell colposcopic directed biopsy to exclude invasive disease and confirm the histology. So then according to the, then what are the things that you are going to do during the colposcopy? So there are several things that you can do. So you can do large loop excisional biopsy of the transformational zone. And then so you have to see the depth, see whether there is the margins are clear, right? So if the margins are clear, so you can do the ablation. So there are so many ways of ablation: cryotherapy, electrodiatemy, cold coagulation, laser ablation. So you should know about these things, method of treating patient. So then according to that, you have to give a small description about these things. But if it is a large loop excisional biopsy is revealed malignancy, of course, then you have to manage different way this patient. So sometimes you have to refer to oncologist, oncologist, or at least he needs to have surgical treatment. For example, extended hysterectomy. Then, if it is a high-grade lesion confirmed by the large loop excision, so then so you have to follow up her for long period of time. So that is combination of cervical smear and, if necessary, colposcopy. Then you have to advise her to avoid or minimize risk factors. So you can offer hysterectomy if a patient having pre-malignant lesion, or if you think that she is lost to follow up. That means some patient you are not trusting them, even though you say that they don't come for follow up. So then in that case you have to consider hysterectomy, considering her fertility, her wish, and the other comorbidities and risk factors. In summary, so that is the answer we expect. So then around these facts you have to explain your answer to get the full marks. So here what we mention in summary, you have to take a history, examine her, counsel her about the condition, about follow-up and treatment, then treatment of colposcopy and directed biopsy. There what you are going to do is, what are the things that you are going to achieve. So according to the results, so what are you going to do and follow up. So what is the place of hysterectomy in this patient? Understand? Did you understand
Yes, sir.
about the answer about this question?
Yes, sir.
Okay. So then last question. So last question on postmenopausal bleeding. No, it is no, it is not. 45-year-old woman, 3 children, present with the history of irregular vaginal bleeding for 6-month duration. So then you have to go through the question. You have to understand she is 45, 3 children, irregular 6-month vaginal bleeding for 6 months. The all history examination, everything normal. Clinical assessment normal. So then list 4 methods of endometrial evaluation in this patient. So what you have to understand when you see this kind of patient in the clinic setting, for 45 or above, if somebody coming with irregular bleeding, so they need some kind of endometrial assessment, because they can have endometrial malignancy or some other significant pathology. So endometrial assessment after 45 is compulsory. That you have to acknowledge first. Then first question is asked, list 4 methods of endometrial evaluation in this patient. So there are so many methods of endometrial evaluation. So then you have to mention first baseline endometrial evaluation, ultrasound evaluation, that is transvaginal evaluation of endometrium, uterine anatomy, adnexia, more importantly endometrial thickness and regularity. So that you have to mention. Then gold standard management is, gold standard way is hysteroscopy and directed biopsy. Third one is OP sampling procedure in the clinic setting. For example, Pipel, Vabra, endosampling, those are the examples. And D&C is the old fashion. Nowadays we don't do much. But examination and anesthesia, dilatation and curettage. Scraping the endometrium is 4th one. So those are the 4 methods of endometrial evaluation. It's easy. You can score 40 marks to mention. Then histology report of the endometrial sampling revealed simple glandular hyperplasia without atypia. Without atypia, briefly discuss the management of this patient. So then you have to understand what is the significance of glandular hyperplasia without atypia. You know, with atypia there is a high risk of malignancy, 30%, but without atypia, so low risk of malignancy. So then there are 3 ways of management of this patient. So you can do expectant management, you can do medical management, you can do surgical management. So expectant management is, of course, so you explain the condition, you tell what are the management options. They say, no, I don't need anything, I will wait like this. But there what you need to do is you have to regularly assess her for any worsening disease or malignancy or atypical hyperplasia. So some patient will decide the expectant management. They wait without any treatment. So that is up to them. But you need to regularly assess at least 6 monthly with the endometrial sampling whether there is any worsening of the disease. The second way of management is a medical management. There are so many options. You can have northeastern, so you can have LNGIUS, you can have DMP. Pardon? Hello? Did you ask any question? Okay. So then, the medical management, there are so many options available. There are, so, progesterone, northeastern, then Mirena coil. So these will revert back to normal because you know that progesterone is low. If you give progesterone long-term basis, it will thin out the endometrium, make it atrophic. So then it make the disease revert back to normal. So at least you have to give 6-month course. You can give continuous or you can give as a interval courses. So then you have to say that, so medical treatment, these are the options. So what is the basis of giving this treatment? So anyway, so if you are going to give medical treatment, you have to regularly assess their endometrium 6-monthly intervals. But if you insert IUCD, that's mean the Mirena coil, so they are, so you can keep it for 5 years if she is responding to it. So hysterectomy should not be considered. The treatment, medical treatment is medical, as I progesterone in form of oral, injection or intrauterine systems. Then surgical management. You have to mention endometrial ablation has no place in the management of hyperplasia. Endometrial ablation means using energy. You destroy the endometrium. For example, thermal endometrial ablation, ultrasound guided endometrial ablation, microwave endometrial ablation. There are so many methods. There is no place that you have to mention. There is no place of endometrial ablation in the hyperplasia, because so you can keep pockets of undestroyed endometrium that can develop as the local lesions. But here there is no place of hysterectomy unless bleeding is not settling with the medical treatment. If we fail to have response following medical treatment, then you have to consider. Otherwise, directly she doesn't have any benefit, because hysterectomy is a major surgery. You can have other complications as well. The other place of hysterectomy, if she is developing atypical or complicated kind of case, so then you can offer hysterectomy later on. So endometrial evaluation in a regular interval is important for this patient. So at the same time, you have to mention about the treatment for anemia. If she is having anemia with the bleeding, of course, then you have to give if she is severely anemic, you have to give her blood, or otherwise oral iron treatment is recommended in this patient. Okay, so then these are the answers, expected answers in this question. So I discuss, in summary, I discuss about the long essay question and other 4 CQ questions. I explain you how to give the model answers, how to plan the answer, how to give the rationale behind different methods, and how to give the principles of different management. So I think you got some idea about the essay question, essay paper. So the better you to regular intervals write your past paper question, at least 5 past paper question. Now you have enough time, and then get ready for the exam. Right. So do you have any questions now? Any questions? Any clarifications? Somebody can answer. Otherwise, I don't get any feedback. I think I'm telling different things. I think that I don't know whether you got the correct information or correct message across. Hello. Hello. Okay. Can somebody answer? Did you clearly hear my this thing explanation?
Yeah, so we heard the
Yeah, okay.
explanations.
Right.
But
So
I have a question. The
yes.
answering the first question is too much difficult in all sort of essays.
Yes. Yes.
This one also I got it wrong. Don't know how to write for these strategies.
Yeah. So
Can
that
you
is the thing.
please elaborate it more?
Yeah, that is why I said this is a model answer for any essay type question. So we'll go back to the first question now. If you start answering, only you will understand how difficult it is. Then you can overcome these difficulties when you practice it. Otherwise, you never get idea how to write this kind of answer. So here it is an essay question. Essay question, of course, need introduction, main body, and conclusion. That is basic principle. So introduction, you have to give the gravity of the issue. Say, if you ask the induction of labor, I said what is the gravity of that problem. So if you ask about the anemia, so you have to tell the gravity of the anemia during pregnancy. If you ask about the cesarean, what is the current cesarean section and what is the gravity of that problem. So then strategies. Strategies means to improve the complications or improve the outcomes of the baby and mother. Then you know that there are different ways that you can do this thing, starting from the antenatal period in some questions. So but the relevant to that question, so you have to select what are the categories of things that you have to select to improve the outcomes. Those are the called strategies. So one strategy, maternal education and counseling. Second strategy here, case selection. Third strategy is senior level enrollment. Those are the strategies. Then on that you have to write down some accounts. Then in the conclusion, so you say if you adhere to this kind of management, so you can have good outcomes. That is a simple way that you have to answer this kind of question. Is that clear?
Thank you, sir. So can you do more in the future?
Pardon?
Can you do more essay discussions for the batch in the future?
Yeah. So then if you want me to do this, some more essays, right? So what you have to do is you have to come with ready-made answers. Otherwise, just listening is not, it will improve little bit, but you have to improve on writing and get the idea. So then you have to come with the ready-made answers. Then you will understand what are your deficiencies. Then you will improve on that in next paper, right? So then I will do the next paper discussion. So I will next week I want to see whether it is on Monday or some another day, but I will create a account and let you know through LMS to be aware, see the LMS. So probably today or tomorrow I will schedule next question paper. That will be last the 2019 paper, right? Everybody should come with a ready-made answer. Okay.
Okay, sir.
Right. Okay. So we'll leave the meeting now. Thank you very much for coming for the lecture. Thank you.
Thank you. Thank you, sir.
Thank you, sir.
Sir.
Thank you, sir.
Thank you, sir.